Hi there. Thank you once again for joining me on the program, Your Doctor and COVID. I'm Dr. Mahendra Carpen. I'm the Head of Medical Services and Cardiology at the Georgetown Public Hospital Corporation. Today we continue our conversations like we have been doing every day around the COVID-19 pandemic. And if you have any questions or comments, please feel free to send a WhatsApp message to 620-6275, or you may send an email to docandcovid@gmail.com. We are now in the first week of January 2021. COVID-19 is still quite rampant around the world. We are seeing amazing new developments in the manifestation of the disease. We are seeing new developments targeting the treatment of the disease. We know that it can affect every single organ system in the body. The big ones that we have focused on so far are the heart, the lungs, the brains, the circulatory system. We will spend some time today and look at the way it has affected the kidneys. And we have with us today, to help us understand this a little better, a nephrologist who has just returned from training at McMaster University and is now stationed at the Georgetown Public Hospital Corporation. He's Dr. Hemchand Baran, nephrologist by training, and we are very delighted and pleased that he is here to join us today. Welcome, Dr. Baran, to the program, and thank you very much for joining us.
Thank you, Dr. Carpen.
So you and I are sitting about 7 feet away from each other, and we know that exposure is considered if you're closer than 6 feet. So if you don't mind, for the remainder of this discussion, we'll take our masks off so that we could have a better communication. We are safely apart from each other. As usual, I would tell my audience, whether they're viewers or listeners, that we wear the mask to cover both the nose and the mouth. And when we're taking it off, we use the straps around the ears to take it off. So you may take yours off as we continue this conversation.
I agreed.
So you are originally from Berbice, I believe. Well, let's tell us a little bit about your personal and your academic background.
Okay. Thank you very much for the brief introduction. And a little bit about myself. As you said, I'm originally from Berbice, East Berbice, and most of my studied primary education, secondary education, I completed there, and I worked for a few years before I proceeded my medical education. I did my medical degree in Cuba under a government scholarship. Then I returned in the late 2000s, and I started to work as a general physician at the New Amsterdam Hospital. I spent some time there, and then about 7-8 years ago, I migrated to Georgetown, where I continued my studies in internal medicine. And I worked for a few years in Georgetown Hospital before I proceeded to do nephrology in Canada.
Yeah, so that must have been some journey. You started out in Berbice, ended up in Georgetown, like a lot of us. You have worked at the New Amsterdam Hospital. Do you still have contacts at the hospital, colleagues, friends who are still working there?
Yes, I do actually have some of my batchmates who are working there, and we are in constant contacts. We try to help each other. I keep abreast with what's going on there in Berbice, and I try my best to help as much as I can.
I believe you are the only Guyanese nephrologist who is in the country practicing in Guyana right now. Is that correct?
I think so, yes.
Okay.
Before I left to pursue my nephrology fellowship, I would have been the only locally trained person.
Okay, well that is very encouraging, and it's good to know that we have young people who are specializing from various backgrounds and are here back in Guyana to provide service and assist in the management of Guyanese patients. New Amsterdam Hospital would have also specific needs that may not always be met. I suspect nephrology specialist interventions may be something. Do you find yourself having to assist answering questions, providing consults, etc. for outlying hospital, not just New Amsterdam?
Yes, of course. I have been getting calls from way up in Essequibo, in Linden, and in Berbice, New Amsterdam specifically. When I returned, I learned that there is a new dialysis center there in New Amsterdam.
Oh, that's good.
And there are quite a few dialysis patients there, which I try to keep in contact with, and I do communicate. My plan is to leave Georgetown and divorce my experience and give my service to these areas.
Yeah, that's very encouraging to hear. We will talk a little bit more about dialysis because a lot of our viewers and listeners may want to know a little bit about what is meant by dialysis, the process, etc. But why did you choose to study nephrology? And for our viewers and listeners, nephrology really does deal with the renal system, the kidneys, etc. But tell us why you picked that area.
A few years ago, while I was doing my internal medicine program, I always wanted to be an internalist. It's a very broad area, and it keeps you at check, doing a lot of research and try to keep yourself updated with information and medicine that has been happening. And then I had an opportunity to go on an elective program at McMaster, which was
McMaster's in Canada.
In Canada, which I spent some time in nephrology there, and I saw something different. There was a lot of internal medicine in regards to kidney problems. It was so more in-depth, and I fall a little bit for the in-depth of the medicine in regards to kidney problems.
Yeah.
And when I look back, I realized that what we are doing for kidney problems in Guyana, we are nowhere near the experience that I have gained when I was in Canada for that short period. And when I returned home, I looked at it, and then I went into the nephrology section to work in the Georgetown Hospital. And I realized a little has been going on for kidney disease patients. And when I look at the illnesses, the death rates, and the frequency of which patients are being admitted in the hospital, it is as high as a cardiovascular or a heart problem. And we're not paying a lot of attention to kidney disease. The other thing is we do not have many specialized doctors. We do have a few foreign doctors, and as you mentioned, I'm the only locally trained doctor that has recently returned in this area of specialty. So I'm hoping that I bring a lot of awareness and attention to kidney disease, as it is related to a lot of complications when it comes to these patients.
Well, we're very lucky that you're here, and hopefully others would follow in your footsteps and also seek specialized training in all of these areas that we have tremendous needs in this country for our patients. How has it been practicing your specialty in particular in the COVID-19 era? What is the practice of nephrology like in the COVID-19 era?
Well, to start, I had two experiences. When the pandemic, or when it was declared as a pandemic, I was in Canada at the moment, completing my training. So I had an opportunity to see what a first world country was doing and how they approach COVID, and more so in my specialty. As in Canada, quite a developed country, and they have all the resources quite available. They take a lot of measures. Social distancing was their first step in prevention. When it comes to the disease itself, there was a lot of testing being done, and it was shown that more elderly patient was at risk, and they also discovered diabetes, cardiovascular disease were contributing factors that put these patients at risk. And as we talk more later in the program about dialysis, dialysis patient, by having kidney disease alone, is even at a higher risk. So they actually do a lot of screening for these patients, and they would isolate them and try to protect them as early as possible. But there I saw a lot of elderly patients diagnosed with COVID. Their survival rate was quite reasonable. I would say it was like a 50-50.
In the early days.
In the early days.
Yeah.
Then I returned home here in late July, started to work. I keep abreast with what was going on in Guyana also. And it sounded like was a bit chaotic, scary in the beginning, in the early months of 2019, 2020. And then later when I returned, there were some systems in place, and there were more understanding to COVID, and people starting to accept and know what really COVID is and how much precaution they need to take.
Right.
It's still a very scary situation.
Yes.
My experience here so far with COVID and kidney disease patient, as in Canada, the figures, they are closely related. There is an increase of kidney disease patients coming into the hospital. And these are situations...
Is it because of COVID or just in general?
Yes. Generally, the previously diagnosed kidney disease patients are coming in more frequently with worsened kidney disease. And there are new diagnoses of kidney disease or acute kidney injury, as we would say. And it's totally regarding to a positive COVID patient.
Oh, so it's related to a positive COVID diagnosis.
Yeah. I have seen about 3 cases so far that produced acute kidney injury with just a COVID-19 test positive without any previous related illnesses.
Are those patients, were they able to recover, or they then went on to develop kidney disease sufficient to require dialysis for long term, etc.?
So I gathered some information before I returned. There were 2 patients that developed kidney disease that required dialysis, and they both recovered after receiving dialysis. There were cases where patients required dialysis because of COVID alone, and because they were so complicated, they never reached the stage of receiving dialysis at some point.
So those who were able to get dialysis, is there like a recovery to a point where they no longer need dialysis, or dialysis now becomes a long-term part of their existence?
I saw both happening. There was actually 2 patients who required a short-term dialysis, recovered completely, and there was 1 patient who needs to continue dialysis. Also to touch on, there was positive patient with COVID who developed kidney injury not requiring dialysis, but later on did not fully recovered their kidney function and required dialysis. So the variation of the disease, it's a bit complex. Right. There will be some patients who recovered fully, some might not recover fully, and some would require dialysis. So it's, when it comes to kidney disease and COVID for these patients, we would need to continue monitoring them.
Okay. So if I understand what you're saying, there are patients who can develop kidney disease solely because of COVID, not because they have any other conditions like diabetes, hypertension, or any other things that normally are associated with kidney disease.
Correct.
Oh.
Yeah.
Well, thank you very much, Dr. Barron, for sharing with us your expertise on the subject of dialysis and kidney disease in the COVID-19 era. When we come back tomorrow, we will continue this conversation with Dr. Barron, nephrologist working at the Georgetown Public Hospital Corporation. Remember, if you have any questions or comments, feel free to send a WhatsApp message to 620-6275, or you may send an email to docandcovid@gmail.com. Thank you once again for joining us.